Hello, everyone, and welcome back to GRUFFtalk. I'm Barbara Hannah Grufferman, your host. Please join me in welcoming Ingrid Harm-Ernandes, who is a pelvic floor health specialist, but she's also the author of The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms. And today we're going to be talking about what is the pelvic floor exactly and why is it so important, especially as we get older. So welcome to GRUFFtalk, Ingrid.
Thank you so much for having me. I'm really looking forward to our conversation.
So let's start at the top. What is the pelvic floor and why is it so important?
That's a great question because I think that's a point of big confusion and misconception for a lot of people is what exactly is the pelvic floor? So the best way to describe it is it's a group of muscles that spans from our pelvic bone in the front to our coccyx or our tailbone in the back, and then out to our sits bones, so the bones that we actually sit on, out to the side. So it encompasses that whole area, looking kind of like a sling or a hammock, if that helps people visualize it. Now imagine that has so many important functions, 5 to be specific. One is supportive. So you imagine that sling or hammock holding up your organs and everything you do every single day, whether you cough or sneeze or lift, is held up by that sling. And that's one function. Another is what we call sphincteric. So sphincteric those are muscles that can open and close in the case of the pelvic floor voluntarily. So let's say if we don't want to pee, it's closed. If we do, it's open. And same for the anal area for bowel movement. So that's a second function. A third is sexual, which is really important to note that these muscles can really impact our ability to have intercourse, our ability to enjoy intercourse, for our orgasm. All of that is significantly important in that third function. The fourth function is what we call a sump pump. And basically that's to help pull fluid out of the pelvic cavity so it doesn't kind of sit in the pelvic cavity. And then the fifth function is super, super important for the whole rest of our body. It works in tandem with our body, our core, and we can talk a little bit about what core is at another time too. It really works in tandem with our core to be able to have our body function in everyday life, everything that we do.
So you just described the function of the pelvic floor and basically where it is in the human body. And why is it called very often the hidden muscle?
Yeah, I think the hidden muscle is probably a multitude of reasons, but some of it is because we've been kind of used to having people just say it's down there. I don't want to talk about it. Whether there's taboo, there are many different reasons why we don't want to talk about down there. So it becomes an unknown because of that. But it also is an unknown because people don't realize they are muscles. And there are a series of muscles that are specific to incontinence, muscles that are specific to orgasm. It's all of that combined. But because people don't realize it, which is why I called my book The Musculoskeletal Mystery, How to Solve Your Pelvic Floor Symptoms, is because people just don't understand that those are muscles and they function like any other muscle in your body. So just like you were to use your bicep, the pelvic floor works the same way, but has lots more functions than just the biceps alone.
Yeah, it really does have a lot of functions. And what are the most common symptoms that a woman might experience after she's gone through menopause? Maybe she's gone through childbirth. Maybe she's put on a few extra pounds. I mean, like, I understand that there are a lot of things like that could really impact the health of your pelvic floor. But what are some of the most common symptoms that a woman might experience that might indicate that all is not well with the health of their pelvic floor?
Yeah, I'd say probably the most common would be urinary incontinence. And I'll put a little note in there that I think, unfortunately, women are told it's okay to leak. So if they have leakage on a cough, a sneeze, or they're jumping or they're exercising, there's this belief with, I just have to live with it. But really, that's a very common early sign that something's going on. Another sign might be pain with intercourse. The tissues get dry. We're also told during menopause that, yeah, okay, so sex is going to start to hurt. It's going to be uncomfortable. You might not orgasm. And the sad thing is, women aren't told there are lots of things you can do that can help that. And you can enjoy those things no matter what age you are. It really, really doesn't matter what age you are, you can enjoy those things. And then some other things I'd say, some signs and symptoms, especially for those who are getting a little bit older, is prolapse, which is a condition where organs start to kind of push through the vaginal canal. And what the woman will experience is like a bulb or pressure at the vaginal opening. And it can be quite scary. You know, a lot of women think, I've got cancer or so forth. It's good to have it checked out, but it actually is pretty common during the menopausal years and what I call so it's interesting, the exactly what we were talking about earlier, the sling idea. If you think of that as a hammock, and that hammock starts to bulge and your bottom hits the ground instead of being suspended above the ground, you kind of have to think of the pelvic floor that way. So nothing is breaking, it's stretching or becoming low functioning, as we say.
Stretching.
It's not able to do its job, right?
And how do things like, which I mentioned, childbirth, menopause, and then, the drops in estrogen and possibly not being at your healthiest weight, how can those contribute to, I don't know, is deterioration of the pelvic floor the best way to put it, or just an unhealthy pelvic floor, or symptoms with your pelvic floor? How do those contribute, and what are some other things that might contribute?
Yeah, so I think symptoms of the pelvic floor is a good way to look at it. Or a low functioning pelvic floor is just not able to do its job. And yes, things like being overweight, smoking, even chronic cough conditions, pregnancy. So think of the pregnancy, the weight of the pregnancy down on the pelvic floor for those 9 months, and then the process of giving birth. All of that increases it. And then as we get older, because those tissues are estrogen driven, we get the dryness that people talk about, but we also have an increase in the rate of weakening of the pelvic floor, which is why it's so very important to take care of it as early as we can. When we first witness some of those symptoms like incontinence or constipation or prolapse, take care of it right away so that we can prevent those things from happening later in life.
About 6 or 7 years ago, I was the spokesperson for a new product that was from Procter and Gamble, a major packaged good company, called Always Discreet, and was specifically created to help women who had leaky bladders, as they called it. They didn't want to use the medical term of incontinence, but a leaky bladder from some of the reasons, like you said, coughing or, laughing too much or anything like that could cause a little bit of a leak. And there were degrees, of course. And some of the statistics that I used when I was going around the country talking about this issue for women, very common, is that 40% of women over 40 experience some level of bladder leaking, which is really incredible. It can be embarrassing. I remember interviewing women who did experience it, very embarrassing, caused them to not exercise, caused them to not have sex, caused them to not even go out if it was severe enough. So that really is a really big issue. And my guess is, given all of the things you've already shared with us, it sounds like that could be the biggest indicator of, and maybe even the most common indicator that, things aren't completely well with your pelvic floor. So now that we have an understanding of the anatomy of the pelvic floor, where it is, its functions, the 5 key functions as you described them early on, and some of the symptoms that might indicate that there is some issue that you need to focus on, what are some of the things that people can do? And it's like a 2-part question, really. One is to prevent having a low functioning pelvic floor, as you described it, for those who don't have any of these symptoms yet and hopefully never will. And then part 2 is for those who do already or are experiencing these symptoms, what can they do? So if you could please tell us that.
Yeah. So there's like 2 sides of that for an answer as well. One is specific to the pelvic floor. So a lot of people hear the word Kegel. I don't use the word Kegel because there is such a misconception as to what that really is. So what I find is when I assess my patients coming in the door and we talk about what their symptoms are and I look at what their pelvic floor is doing, and they're like, well, I've been doing Kegels for years and they don't do anything. I said, well, that's because not only are you doing the exercise incorrectly, you're doing something that makes your symptoms worse. And they're shocked. They're shocked that that can even happen. So what I would say to folks is, if we can start with proper pelvic floor exercises and knowing when to do them, because not everybody should be doing them. We need to have that understanding that they can be good for a certain set of people with certain symptoms, and they can be detrimental to certain people with certain symptoms unless we figure out what that is. And what I mean by that is you can have a pelvic floor that is too tight. And if you're trying to do 101 pelvic floor contractions, you can make it tighter. Right? That person needs to learn how to relax their pelvic floor first. Then they can start with strengthening if it's appropriate. Those who can start with pelvic floor strengthening right away, what I like people to think, I can describe here kind of how to get the idea if you're doing it right or not. And how I describe that is you can imagine putting a straw in the vaginal canal. So just imagine that. And then what you do is you use the muscles of the vaginal canal around that straw to pull the fluid up and inward. So the sensation is up and in. And I don't say squeeze, because what people do is squeeze their buttocks, squeeze their abdominals, squeeze their face. They do all sorts of things, but use the pelvic floor because we don't see it, right? So we want to make sure that that pull up and in maneuver they can do it and that they can relax it. So can you let that pelvic floor contraction go? So my comment on that is if you can find your pelvic floor and you can do it, you're probably okay starting a little bit of a routine of gently holding and relaxing. If you can't find your pelvic floor, if you can't relax your pelvic floor, that is your sign to go to a pelvic PT, because they're going to tell you this is what you are doing, this is what you're not doing, this is what's good for you, this is what's not good for you. So that's the big answer to the whole pelvic floor kind of contraction idea. And I spend 4 pages in my book on describing how to do a pelvic floor contraction and relaxation. That's how important it is to get it right to help yourself, right? So that's one whole side of your question. The other is overall lifestyle things. And what I mean by that is maintaining a healthy, good weight, being outside, being active. That could be walking. That could be, I'm a little cautious about saying running for a reason, because it's a high impact activity. I prefer people to start with low impact activities and kind of get themselves active that way and move forward with that. And then also there are techniques that physical therapists treat on how to avoid urgency, because urgency is a big one. My patients, they don't want to leave their house because they're so afraid they're going to leak on themselves because they can't make it to the bathroom, right? Constipation, it's so painful and uncomfortable. They feel like their belly is pregnant because they can't go. These are all things that pelvic floor exercises can absolutely help, but we have to make sure that we're doing the right thing on both sides and having a good, healthy lifestyle, like drinking enough water, eating the right foods, more high fiber foods, and all that will help that as well. So that's kind of the bigger picture of things to answer your question.
I just did an episode on fiber, which really is like an unsung hero for overall health and wellness, and also many longevity experts who I follow very closely talk about fiber as really being the secret sauce for really living longer and just kind of really expanding your health span more than your lifespan. So it's really fascinating to me that you brought up fiber, and you mentioned hydration. How important is hydration to the health of your pelvic floor?
Tremendously important, because as we keep our fluid levels up, we keep our muscles functioning at their optimal, right? So we allow those muscles to function better and do their job better. And at the pelvic floor, that's extremely important because we don't see it. So it's not like, oh, when I do my exercise, my biceps or whatever else, I can see it. At my pelvic floor, I can't. So we don't know what we're doing to our pelvic floor. So fluid helps keep that muscle health up. If we talk about tissue health, especially during menopause, it's extremely important because if we dry our body out, we dry out what are called mucosal membranes. So our eyes, our nose, our pelvic floor, our mouth are all mucosal. They should always have moisture there. So if we're not drinking enough water, we're not producing that moisture. And that could be painful in daily activity, painful in urination, painful in sex. There are all these things that can happen. So hydration is like, that's one of the things I start with my patients is trying to regulate caffeine, water intake, soda intake, everything else, because it's such an impact on the pelvic floor.
And if the pelvic exercises, as you describe them, whether a woman chooses to do these on her own or seeks advice and guidance from a pelvic floor PT specialist, what if it doesn't work? Are there actual treatments that are available to women to help with
Yeah, so within pelvic physical therapy, we look at all the things that we've just talked about. We look at all of it. So when I do my interview with my patients, I'm asking about every single component that we just talked about, even if they said, I'm just coming in for incontinence. Because invariably, someone who comes in for incontinence might also have constipation, might have pain with sex, and no one has talked to them about it. I have so many patients say, no one asked me those questions. No one wanted to know if I was having pain with intercourse because I was talking about incontinence or whatever it may be, right? So talking about all those things helps us then set up healthy lifestyles. So in pelvic PT, you don't just get the pelvic floor exercise or use of biofeedback, which we may do that. That's a unit or a device that helps us have the patient actually see what their contraction and relaxation is and helps them teach that. We may use something called wands or dilators. They're meant to help stretch the pelvic floor if it's gotten too tight or treat trigger points and muscle tensions internally. Just like you might treat a muscle somewhere else on the body, we could treat that internally. So the physical therapist may do that work with you, and they will probably also teach you how to do that work on your own, because that's important that you learn how to do these things on your own. We'll do dietary changes. We'll do urgency drills, as we call them. I could go on and on. It would be a long conversation in itself that we do. But all of these things leads to that teaching someone how to live healthy, because a physical therapist wants that patient to go off on their own and take care of themselves. We don't want you to rely on us. We want you to be able to take care of yourself.
Right. You mentioned running before as like not really an exercise that you applaud because of all the bouncing involved. And I am a runner. I'm training for my 16th marathon that's coming up in early November. But and I just did a 25-mile training run yesterday. But I have trained myself for a lot of reasons, to protect my joints, my knees. I have a mild arthritis in one of my knees. And also now I'm going to be much more cognizant about the health of my pelvic floor, which, knock on wood, so far seems to be okay. But I am cognizant of this, and I've trained myself to not bounce as I'm running. It's a very kind of even-keeled run. And so for anyone out there, who might be experiencing some dysfunction in your pelvic floor area, maybe, and you are a runner, kind of focus on that. Try not to bounce up and down or pound the ground too hard for a lot of reasons, not just because of your pelvic floor. So just a little sidebar on that. But we did mention some of the symptoms, like, incontinence being one of them, painful sex, which of course I'm sure would be confused with kind of the more normal, typical dry vagina issue that many women do experience. It's very, very common because of the drops in estrogen when women go through menopause. So I'm sure that there could be some confusion with that. And maybe they're being treated for that, but it's still not working because they haven't addressed their pelvic floor, right? I'm sure you see this all the time. But, some of these symptoms can be embarrassing, as we talked about, and it could create like a emotional, challenges for some women, and as we said, stop them from doing certain things, stop them from living their lives. But so, what advice do you have? You've been doing this for 40 years with a specific focus on the pelvic floor health of women and overall women's health for about 28 years at this point. So, what advice do you give for women who are nervous or hesitant about seeking help from an expert like a pelvic floor specialist or PT?
Yeah, so unfortunately, it's actually very common that people are nervous or worried about going to pelvic PT because they don't know what it entails. And so unfortunately that even so urogynecology is a field that really works hand in hand with pelvic PT. And even within their field, less than 50% of the women who are referred to pelvic PT go. And a lot of it is because they just don't know what they're going to experience. And it's kind of scary, or it's offered matter of factly, like, yeah, you could go to pelvic PT, instead of this is going to change your life, right? So what I would say to people who are nervous about going is, understand it will change your life. It will help you not only solve what's going on right now, but also prevent problems for the rest of your life. The pelvic PT is going to sit down with you and is going to discuss your whole case. I usually spend a half an hour with my patients just talking about what's going on down there. And then once I understand better, only then do we move to any kind of treatment. And I explain, just like we talked about today, I have a little three-dimensional model and I explain exactly what is going on at the pelvic floor. So when we're ready to start treatment, they're like, oh, I've got it. I understand why this is so important. So please understand that if you're having problems, reach out. You may have to be the one that walks in the door with my book to the doctor and say, hey, I need to go to pelvic PT. This is really important. And that's okay, because not only are you helping yourself, you're advocating for the next person walking in the door. Because the more people who talk about it, the more it normalizes the conversation, the more people get help for it, the less worried and nervous people are going to be about actually getting treatment.
Your book is a fantastic resource with great examples and, step-by-step solutions. And what made you decide to write this book?
After treating for so many years, I was so frustrated that patients were often, it was taking 10, 20, 30 plus years before they walked through my door. They were living with symptoms so long. And I kept asking myself, what is going on? And my answer to myself was a gap in knowledge for both practitioners and for patients, meaning patients didn't have the opportunity to learn because there was no one out there teaching them. And doctors and nurses and PAs don't necessarily learn this in medical school. So they don't necessarily jump to this as being a first line of treatment, yet research shows it should be a first line of treatment. It's a conservative, effective method to go to pelvic PT, right? So what we have to realize is there's this resource out there that is available for people, but they don't know it's there. So I wrote the book because I wanted to get that knowledge out there. So we describe the pelvic floor in detail and the core, which we haven't even gotten to how that all connects yet. But the whole core, when you run, when you do exercise, it's important to understand that link. Of what the true core really, really is. So we talk about that. I link it to diagnoses, all the different kinds of diagnoses you can have. I link it to, hey, what would you get in an assessment? What would you get in treatment? There's a whole section on self-care. What do you start doing to help yourself? And if that's not enough, it's time to go to pelvic PT. And then there's a section in the back on how to avoid Dr. Google, because I have so many patients who come in and are so afraid of, what's happening in the body, right? So we don't want Dr. Google dictating kind of, what we do and what we learn. The book is that reputable resource. So that's my goal, is to educate people across the broad spectrum so everybody's talking the same language.
And thank you for writing that book, because clearly this is a topic in an area of the body that is still just not focused on. It just isn't. And we only think of, when you say the words pelvic floor, one word pops up and one word only, and that's Kegel. And it's so much more than that. And so I applaud you for that. How can people find pelvic floor health specialists and PTs who focus on this in their areas? How can they do that? Because I'd like to include it in the show notes.
Absolutely. So the APTA, the American Physical Therapy Association, has a main website, and then we also have a pelvic health subset, the Pelvic Academy. That's a subset of our APTA. If you go on there, there's a PT finder. If you're in a more metropolitan area, you'll probably get a lot more. If you're rural, it's a little bit less. We are trying so hard to spread this out into rural areas so everybody can get this care. Everybody can benefit from it. You will see after their title, sometimes you'll see a WCS, that's a certified through our organization, and it's board certified. You have to go through a pretty long process for that. You'll also see other certifications through a group called Herman and Wallace and the APTA themselves. You can look for all those, but you want to look underneath. Generally, they'll list what kinds of things they treat. Some might focus a little bit on postpartum pregnancy. Some might focus a little bit on menopause, and you can look, but generally a pelvic floor PT will address all of the different needs that we just talked about for both men and women. But it's kind of cool because your audience menopause focused. You can sometimes see that they focus a little bit more on menopause and the needs that occur during the menopause, and that's before, so perimenopause, menopause, and post. It's a long time frame. It's not just a couple of years when you're 60 years old is what people think. No. Some women start actually in their 30s, and some don't go through it until long into their 50s and 60s.
No, it's ongoing, and I'm glad you brought that up because this is a commitment. I mean, it's a lifelong commitment, just like eating well, exercising other parts of your body. I think everyone has to understand it's like, oh, I'm going to do this and fix it, and then I'm done. No. It's a commitment that you are going to be making to keep your pelvic floor healthy and functioning well. So keep that in mind, everyone. Whether you do it on your DIY with the guidance from, let's say, Ingrid's excellent book, or you do see a specialist, whatever path you choose, please remember that you're making a commitment to keep this part of your body healthy. You remember from the beginning of the conversation, 5 very important functions. And there's even more than that. We took a deep dive, but you could go even deeper. And that's why I'm recommending that you read Ingrid's book. So Ingrid, this was a really great conversation. We covered a lot. And I always like to ask my guests before we leave the conversation, what are your 3 key takeaways you really want the GRUFFtalk audience to remember from the conversation today?
Yeah, so I'd say one of the first ones is, we kind of touched on it before, is that these conditions are common. They're not normal. We don't want people to think that it's okay to live with painless sex and incontinence and constipation. It's not okay. We want to normalize the discussion around it. So exactly what you're doing with your podcast, which is, I applaud you, so awesome, is to open the conversation up and get people comfortable with talking about it. That is on the practitioner and the patient side. Everybody needs to be more comfortable about talking about down there. We need to bring that to light and have people feel comfortable and confident that they can take care of themselves, right? I think those are huge, huge points. And then the third one I'd say is, understand there's help out there. Right? You don't have to live with these conditions. You're not alone. There's so many people, as we talked about the statistics, there's so many people who live with these conditions. So please seek out the help. Look for good information on it. Listen to all the different things that can help you, and you'll be on a good path to healing and getting better and getting that pelvic floor working. And I mean, it's a beautiful part of our body. We shouldn't think it's something we don't talk about. Understand it's a beautiful, great part of our body that's got lots of function with not much recognition.
Yeah, that's so true. It really isn't focused on, and I'm guilty of that too. And people can get overwhelmed, Ingrid, like think, oh my gosh, another body part I have to focus on. Like I want to focus on my brain health and my heart health and my bones, which is a really big initiative of mine personally. And, but everyone, you have to just get started and it'll become a routine focusing on your pelvic floor. It's a commitment. You want to keep it healthy. You want to get it healthy. You want to keep it healthy. You want to keep it functioning at a high level for the rest of your life, because that is how you will age better. Ingrid, thank you so much. I really appreciate the time you gave us all today, and I hope you'll come back.
Oh, thank you so much for having me. I'd love to come back. We can make some more deeper dives into certain topics. I'd love it.